I'm James Fenwick. I've been a renal patient since 2007. I had a kidney transplant back into the beginning of January 2008. Towards the end of 2014, unfortunately, that transplant began to fail. I had to have, we tried going on to PD dialysis. Unfortunately, that didn't work, and ended up having to go on to hemodialysis. So numerous operations to sort out all these different tubes and bits and bobs. Unbeknown to me, is whilst I had my transplant, the anti-rejection medication caused me to bones in my hip to die, which gave me vascular necrosis, which is one thing on top of everything else just before Christmas you can do without. So they stopped me anti-rejection medication whilst I had the transplant kidney. Although it had failed, I still had to keep the medication going. And then come round to later in 2015, I had to have the kidney removed because I went into rejection unbeknown to us, because I had an injection for about 2 months before we knew it was rejection. So I had to have the kidney removed. And then from June of 2015 I had to have surgery on my hip to try and restore the blood flow to the bone, which doesn't look like it's worked. It looks like it's collapsed more and further. Well, things have been getting on top of me for a while and we're struggling with it all. But after I've been in hospital for about a week, I was in hospital for about 5 weeks past having my kidney out, because it was a couple of weeks in Doncaster and then transferred me to Sheffield, and then there was delays in Sheffield, and then went to transfer me back to Doncaster. It was a few more days anyway. So I was in for about a fortnight, I think, in June after I had this operation, because I got an infection. And a couple of nights of absolutely agonising pain like you wouldn't believe. Unfortunately, it got all too much, and I suppose I had a breakdown. Well, I spoke to the doctor and mentioned it, and he got me referred to the inpatient counselling service. And then she came to see me to assess me, to saw how much of a mess I was, and put me in for urgent treatment, I suppose. And I started my counselling from there, and eventually it did help. I suppose what I'm wanting to really put across to you guys is, it wasn't offered at any point. No matter, they could tell. You could tell when people are right, because they don't want to spend 4 hours at a time on dialysis. 3 times a week. And when you start cutting your time short because you don't want to be there, you think these were indicators. But nothing was ever picked up, and it took me to have burst into tears at dialysis for the doctors to come and see me to help me, to admit me for the night just to make sure I was alright. And I don't know if it's policy, or even if the depression scale test thing should be given to the patients on a regular basis to make sure they are doing alright. I don't know if that's something that could be done. I don't know, but something needs to be done to try and help us, because it's not always obvious, as we know from the TV. Everybody looks normal when they're mental health issues, but it doesn't necessarily mean that's the case. But if we could just try and do something to help us, rather than being told you have to go through a talking shop and then, or go through your GP, go through a talking shop, and you have to jump through all these hoops before you even get anywhere, if you can even get anywhere. There are other patients now that I know of and are struggling, but they've done everything they can through the hoops and nothing seems to be getting done about it. So there needs to be something in place to try and help.
Brought to you by Doncaster Clinical Commissioning Group.